I'm Dr. Michael Latola.
And I'm Megan Strong.
Megan tells me to take a flying leap, and I oblige.
And then in the news, Red Rover, please don't run your dentist over.
And can over-the-counter whitening strips really cause this much damage? That and more on today's Chairside Live. What is up? Hello and welcome to episode 147 of Chairside Live.
What are you doing?
I sense the scent of another male dentist. Who's been sitting in my chair?
Well, I'm sorry, Dr. Joshua Austin was filling in for you for 2 episodes.
There's not only fingerprints, there's literal finger indentations in this cup. What was happening was he was strangling this cup while he was here.
Apparently he has a very strong grip.
He does. I've shaken his hand before, and it's a crushing experience. So,
wow.
How did he do? Pretty good?
Yeah, he did great. How was your trip?
It was fantastic. It was Australia and New Zealand are magical places. The dentists. It feels like mid-2007 down there because Emax is just taking off and starting to hit its stride. Bruxer is still relatively unknown. And I was like, I want to buy stock in solid zirconia while I'm here because you know it's going to blow up like it has in the rest of the world. And they're just starting to hear about it. There's not that many labs doing it yet. And it just gives it kind of a charming feel. Like it feels like you can go there from the United States and predict the future. You know, not who's going to win football games or lottery numbers, but at least you can predict. I think I know what restoration is going to be popular in 4 years. I don't know how to turn that into cash. Or I would. How are you doing?
I'm good. I'm really good. My hair is still in limbo, but I have a hair appointment next Tuesday to finally fix it. My regular lady is back from her maternity leave, and so it's on its way.
Our long national nightmare will finally be over.
Right. I know you guys have been waiting with bated breath until my hair returns to its normal hue, but
it was all a big topic in Australia as well.
I'm sure.
It was. Cover of Australian Dental News today.
Okay.
What's up with Megan's hair? Right. Almost a week away from it being done. We've got an interesting episode for you today. With maybe a surprise or two, and we've got a good case of the week as well. This is one that I wanted to show because I like to talk about digital impressions and CAD/CAM and some of the advantages it can give the dentist, the laboratory, and hopefully the patient as well. And as I was walking in here to do it today, Cindy, my technician, stopped me and shoved a case into my chest and said, "Show this one too. I'm angry and people must know about it." So 2 little cases for you here on the Case of the Week. We've talked a lot on the show before about doctors approving anterior designs. This is an example of a doctor who wants to approve a posterior design. This is crown, an Emax crown for tooth number 3. And the doctor, you can tell this is an Omni Cam from Sirona because you can see that it's a color scan that's been used here. And you might be able to recognize some of the icons as being from the Sirona system. And so we've designed the crown for the doctor, and even though it's a single unit Emax crown that the doctor could do in his office or her office, they've decided not to do it and send it to the laboratory to have it done. Most of the time this happens on anterior teeth or when they want to do solid zirconia, which they can't, as of today, do in their office. So they'll usually send it to us, but this happens to be a posterior single unit Emax crown, which could be accomplished in the office. But who knows? Maybe the patient had to leave for some reason. You don't know. This is the internal portion of the crown, and you might be wondering why that looks like it does. And one of the things to keep in mind is that all the milling instruments, all the burrs that are inside the MCXL mill are rounded. And so anywhere you have sharp angles, it's going to over-mill to make sure that the crown is able to fit on the prep itself. So if we look at the preparation, there are some sharp angles here, and it's not going to mill like a perfect replicate of this because it can't on some of these sharp angles. And there's also some areas where we have undercut. You know, as you look at this preparation, you'll notice that there appears to be kind of a worn DO amalgam next to it and kind of a bulging restoration actually on the other side. And as we kind of look at the prep from some different angles, we can see the interproximal here where we have a little deficit. That's certainly an area where technicians look and feel like, especially on a prescription like this one, where on the digital prescription the doctor asks for broad, wide, accurate contacts, which is an exact quote. And it's tough to make accurate, or broad, wide contacts for that matter when you have a deficiency on the adjacent one. And I think it's something that we brought up before, and I think Dr. Austin brought it up on his case of the week when he was looking at some of these cases. And again, we can see we've got actually an excess of amalgam here, so that's an area where a sandpaper disc could probably take care of it. You can see the margin where at one point it looks like we have the margin, then you can see we have some more margin down below there where that gingival margin really probably is, which is all the way down here when it comes time to mark the margin. Little indistinct along here. See where the tissue looks like it's growing onto the tooth a little bit? And that is one of the areas where sometimes you can get a false sense of security when you go, oh, well, here's the pink of the gingiva and there's the dentin shade of the tooth. But in reality, this would be a much cleaner impression with better retraction in between these two. And so sometimes the new higher color cameras can give you a false sense of security. If you look at the margin around here, that's pretty clear, where the tissue stops and the tooth starts, because you can see, a little shadow going on there beyond it. And here it gets a little indistinct. A diode laser carried along there, or a number 2 retraction cord on top of a 00, would have gotten some good lateral retraction like we have here between the tissue and the tooth itself. So the basic principles of treating the tissue and retracting the tissue away from the preparation still hold true, possibly more so, I would argue, with digital impressions than with traditional ones. So you can see the margin comes around. And again, blowing these up like this, you can see a couple dings, and you get to see so much about your dentistry that you should almost get CE credit, at least an hour. It looks like the margin's going to come around here, but you can see the margin comes around here, so we definitely have a little undercut over in that area too. And when it comes to those undercuts and those sharp edges, that's why we start to see some of the milling strategies that we do in step mode to be able to take into account the areas that are undercut where it needs to leave extra room, or where it's got a 90-degree angle. Since the burr itself is rounded and can't do that 90-degree angle, the burr has to mill beyond that to make sure that crown's still going to be able to seat. And so this final design that's been proposed and that we've adjusted for the crown will be sent to the doctor, and the doctor can approve it before it's milled. Again, this is a way where in the future, as you get more involved with digital impressions and CAD-CAM, you're going to be able to have this true kind of team relationship with your technician where you can approve things before they're actually made. And this is going to save on remakes. This is going to save on money. You would expect this not to be a remake if the dentist is going to approve this beforehand. So the dentist in the lab might come to some sort of understanding about, hey, we know remakes are going to go down if we do this. Therefore, we can adjust what's being charged for a crown because of this, because we're willing to do it. But then you'd also have to give the laboratory technician the ability to look at this real time and say, well, look, if you want me to charge you less money because we know there's going to be less remakes, I want to be able to see this before you send it to me, so I can say, hey, why don't you take a sandpaper disc and flatten this out, and maybe you can add a little to that composite, or maybe just flatten that out at the same time. So it will give us the opportunity to work in tandem with our technicians to be able to reduce remakes. And one other case, my technician Cindy just stuck this in my hand as I was walking in, because this is her pet peeve. And I just happened to see her in the hallway, and she just happened to be angry enough to shove this into my hand. And we've talked about this before. And we've talked about it usually for bridges, but here we're talking about a single unit. This is old school now. Here's a doctor asking for a cast post and core. I can't think of the last cast post and core that I did. In fact, on this tooth, I have no doubt I would have put a fiber post and core and done the build-up myself and taken impression of the full prep. But this is a dentist who wants a cast post and core and then a Bruxer crown on top of that tooth. And of course, Cindy's beef is with the impression. And the impression, is simply of the opposing teeth and the prep and the ones next to it. So, we don't have any posterior support. We have no idea, even side to side, if this is correct, because it wasn't done with a bite block or any kind of posterior support here. And now we're trying, it looks like a full denture maybe on the top. And now it looks like we're trying to make a cast post and core and a single unit crown that's going to fit in here. And we just feel like we're guessing. We feel like the chances of the patient coming in, getting anesthetized and have everything put in their mouth and have it fit go way down when something like this happens. So This is just an example of, usually, if there are molars present, we'd love to see a full lower arch. And if there isn't, we'd love to be able to do a bite block for this doctor to help stabilize this and make sure we get this correct at the same time. Also, of course, I would love to see the doctor do a post and core, a fiber post, and then a composite buildup around there and do it directly into the tooth and build it up to ideal and do that prep. It's just one more kind of indirect step for us to be able to do it, and I'm not sure that metal is necessarily the best material when we have things like fiber posts that'll bend at about the same rate as dentin does when that tooth is chewed on it. So that was just a little bonus case that Cindy angrily handed me as I was walking down the hall and said, here, show this on the case of the week and make sure that we don't get too many more of these. But really the bigger message was, for me, is that through digital impressions and through CAD-CAM, all of a sudden now we can work with our laboratory technicians real time using something like WebEx or Go to My PC, and they can look at our preparations in the adjacent teeth, and then we can actually approve the proposal of the restoration before it's milled. And hopefully it should work together to benefit not only the lab and the dentist, but most importantly, the patient.
Thank you for that, Dr. D.
No worries, mate.
Oh, wow. Now let's go to a segment we call Viewer Mail. This week's viewer mail comes to us from Megan Strong in Southern California.
Really?
And she writes, "Hi, Dr. Datola. I heard that you recently jumped off a building in New Zealand. Please explain."
Well, yes, I did. I stepped off a building.
You stepped off a building.
Yeah, I didn't jump off it.
Well, hey,
I was. I don't want to sound brave. I was tricked into it. And here's what happened. I was in Australia lecturing. My best friend, who I went to kindergarten, grade school, high school with.
Wow.
He and his family moved to New Zealand about 18 months ago. He used to live in Taos for 7 years, and we never saw each other, even though it's 2 states away. And here we were on the other side of the international date line,
right.
And I thought, I've got to at least go to New Zealand and spend a couple days with him. So he said something just in passing about, we should bungee jump or just something like that. I was like, no, we're 50. Give me a break. Let's do something else. Let's go sip coffee somewhere and complain about whatever guys complain about.
Loud music.
Loud music, exactly. Damn kids. And so he picked me up at my hotel, and he said, "You want to go get a cup of coffee?" And I said, "Yeah." He said, "Let's go to let's go to the most scenic place in Auckland. Best view." And I said, "All right." So we get in the car and we drive, and I see the tower sitting there, and I start to put 2 and 2 together, and I said, "Is this where the best view is?" And he said, "Yeah, it's the best view." And I'm terrified, not terrified, but I don't like elevators.
Right.
And it's because of him.
Okay.
He is the reason for my phobia. Because when we were kids, we used to his mom worked in a department store, and we'd get in the elevator, and in between floors, he would pull the doors open and stop it. So you'd be looking at a solid concrete wall, and you could see where people had written graffiti. So there was other idiots like him who had pulled the doors apart. And sometimes they wouldn't come back together, and you'd get stuck. So I've been stuck in elevators before with him, and I hated it, and now I realized I was going to have to go up whatever it was. It happened to be 63 floors to go up and have coffee. And as we were going to get on the elevator, I said, "By the way, the reason I hate doing this is because of you. You're the one dragging me onto this elevator.
You should be paying
and
for
you're
my
the reason
therapy."
I hate, and well, as it turns out, he paid for all of this stuff. And so before we went on the elevator, we went over to this desk, and he said, "Well, let's do the walk when we get up there." He didn't tell me what it was. He said, "There's a walk you can do around and really get a good view." Innocent enough. So I go into the restroom and use it, and then come back out again. And there's a consent form with my name on it. And he's filling one out, and I turn to the guy and I say, "Oh, this is the wrong one. We're doing the sky walk. This one says sky jump." And he goes, "Well, that's what your friend said you guys were doing." And I was like...
That's where I would have turned around, got in the elevator, and went back down.
Well, no, we hadn't gone up the elevator yet.
Oh.
And I kind of put a little objection up. I was like, "No, we're not doing this." He's like, "Come on, it's my 50th birthday." And our birthdays are 9 days apart. It's like, it's mine too, and I don't want to do this for my birthday. I don't know what I want to do. I just know what I don't want to do, and that's this. But then this is the one guy, just because we've been close since kindergarten, who can influence or exert sweet peer pressure on me to get me to do something when other people couldn't. You would have never got me to do this. Lindsay wouldn't have. James wouldn't have. I would have just said, "No way." In fact, a couple days before, Lindsay had done this climb on the Sydney Bridge, and I was like, "Yeah, go ahead. I'll take pictures of you while you're up there."
Meet you at the bottom.
And yeah, exactly. And I realize now that it wouldn't have been that big of a deal to do. after this. And so we signed up for it, and they give you a breathalyzer test to make sure that it's not just some harebrained idea you came after some day drinking, after waking up with some mimosas at brunch, I guess. And we had an hour till it was our time. And so they said, in the meantime, you can go up to the lounge and take a look up there. And I was like, oh, great. So we rode the elevator up with the glass floor, which is an interesting feeling. 60 floors up, hung out there, had a cup of coffee, rode the elevator back down, got into our tight jumpsuits to make sure you don't slip out of it, and then rode the elevator back up again.
Okay.
And then this happened.
Oh, gosh.
And I hadn't done the math, and she's going to...
Kia ora everyone, I'm here with Mike on top of the Auckland Sky Tower here in New Zealand. He's about to jump off the building, 192 meters, so that's about 630 feet.
Wow, I hadn't done the math, and now I wish you hadn't either.
See, 192 meters didn't sound like much. That sounded like, to me, like what, the length of a football field. So as a dumb American who doesn't know how to do like metric conversions and things like that, 192 meters didn't sound that bad.
And
as
you're
it turns out,
smiling,
it was
which
gonna
is
be,
interesting.
That's kind of a fake smile.
Okay.
If you ever, and the sun's kind of in my eyes too.
Right.
But here's this teenage girl from New Zealand. She was nice enough, but look at, I'm going to trust my life. So here's the ramp, and then she has me look down, and that spot, that's where I'm going to land.
Okay.
She doesn't tell me if that's blood from my friend who just jumped.
Yeah.
No one's given me confirmation he's still alive.
Oh, gosh.
She just says,
no thumbs up from the bottom?
You see that? You can't see. I mean, it's just a tiny red spot. They're like, there's the red spot where your friend landed.
Oh my gosh.
And I'm like, well, all right.
No,
and then as we go through this, she hooks me up in a couple places, and she hooks me up in the front and the back. And I said, oh, it's in the back too. I wanted to make sure, because I liked when I could see her hook it in the front.
Right.
In the back, I just heard it click, and she said it's clicked onto the back. As you see later, she seems to unclick that one right before I go.
I'm not sure why, but...
And then basically she says,
no, I don't know if I can do it.
Here goes Mike in 3, 2, 1, go!
so they won't push you, but they just kind of let you fall.
You don't look scared.
Well, you know why it looks slow till you see it from another angle?
Right.
You'll notice, I don't know if you can see, but my hair's not going up like yours. It would be a much more impressive sight because you would look like one of those trolley racers because your hair would be... My hairs are on my knees. You just can't.
That's right.
And you know what the weirdest thing is? It's not that last step that's hard.
Yeah.
It's the 3 steps to get out to the last step.
Okay.
Because that's where you know you could turn back. Once you're standing out there...
Point of no return.
Yeah, it feels like you've already made the decision. You've committed at that point.
Right.
It's those last 3 to get out to the edge where I was really blown away. And as you can see, they time it perfectly, and it starts to tighten up before your legs hit the ground, and you land in essentially a standing position with your knees bent, and that's all of it. And
You
it
survived.
Really is. I survived, and it really was fun. It was interesting. I would do it again. And I'm kind of glad my friend forced me into it because I learned something about myself. I had this belief in my head that I was too terrified to do that, that I didn't like elevators and wouldn't ride elevators that were 63 floors, and then I would never step off a building or bungee jump or whatever. And it's kind of neat now. It was kind of like doing an Ironman to go, oh, I did this thing that I never thought I could do before.
Right.
That's different because you train for 7 months.
Sure.
And this is more of an impulse buy. But still, I liked that afterwards. It was like, oh, I had this limiting belief about myself that's now gone because I was kind of nudged into it by my friend. I wasn't pushed, but I was kind of pulled into it by him. You've jumped out of an airplane before.
I have.
Something else that would blow me away, and I have a limiting belief in my mind that I can't do it. But what were the circumstances for you to jump out of an airplane?
It was Brandon's birthday, and I surprised him.
By pushing him out of an airplane?
Right, basically. No, but actually I said to him, okay, well, we're going for an adventure for your birthday. And we had talked about it before.
Oh, okay. Because otherwise that's not good form.
Right, but honestly, now looking back on it, I don't think that's like the right thing to do with somebody. You don't just surprise them with
near-death experiences.
Right, with jumping out of a plane, because he kind of was like, oh, okay. He was excited, but he was also saying, you've had, however long you've been planning this, a month to, prepare yourself. I have an hour.
Right.
But he ended up loving it. We had so much fun and whatever, but I don't think I'd do it again. Why throw the dice?
It is one of those things where, and that was really so safe that I would do it again. I would have done it again then when I was pumped up. But 6 hours later, it kind of hit me that I stepped off a 630-foot building.
Right.
I'm not sure I want to do that again, but I'm really glad I didn't have a month to think about it.
Right.
You know, and Brandon thinking about it for a month, I would have talked myself out of it clearly. I'm glad I didn't have any time to think about it, and I just stopped. My dad, though, he jumped out of a plane, I don't know, 9 or 10 times. He's done stuff like that. And still the riskiest thing he ever did, eating oysters at a truck stop in Mexico.
Wow, that
hepatitis
is so brave.
In the hospital for 7 weeks. Skin turned yellow.
You're joking.
No, it's oysters at a Mexican
Who
truck stop?
does that?
Is that not a suicide attempt
It
legally?
is. It
I think that's what
absolutely
it was. But that's even more
Producer
daring.
James just raised his hand,
Yeah,
so that means he probably did it too.
That's more daring than jumping out of an airplane, as far
I
as
think
I'm
so.
concerned.
But so you know what? Now, as we're talking, I'm thinking, okay, so you don't want time to think about this. I say one random Chairside Live day, we totally take you, blindfold you, we go in the car, we drive, and we go jump out of a plane.
Well, now you already told me. You ruined the
But
surprise.
you won't know.
No, it's going to have to be. Well, no, now I know. If
But
you
you
ever
won't-
put a blindfold on me.
You won't know the day
Actually,
that it happens.
people don't know, but about every other episode, she puts a blindfold on me at the end of the show.
And
then I just sit here and wait for something to happen. It's a prank. She leaves. And Saturday around noon, I go, I guess she's not coming back. And James and everyone, air conditioning's off. I'm in a pile of sweat. Well, anyway, that's what I did with my free time when I wasn't lecturing. That was way more stressful than getting up and lecturing in front of hundreds of people, as far as I'm concerned.
I'm sure.
Right.
We got some news.
You would do. Give it to me, baby.
Okay. A 22-year-old UK man wanted to look like actor Channing Tatum, but ended up with a hole in his throat after using a teeth whitening kit. He says 2 days after using Crest 1-hour express strips, he developed a sac of hydrogen peroxide under his tongue. After 6 days of pain, he went to the hospital where doctors removed the sac, fearing it could burst and burn all the way down to his stomach. The sac was drained from a tube, inserted through an incision in his chin, leaving him with a hole. They also removed an infected molar. Despite the ordeal, the man had a laser teeth whitening procedure done at a local beauty salon in his continued quest to have a Hollywood smile.
First of all, he's not going to look like Channing Tatum if
just by whitening your teeth?
right.
Honey.
That's not going to happen.
No.
That's not going to do it. Yeah, you're going to have whiter teeth. The story absolutely confused me. I didn't read this story ahead of time because I was in Australia. But he had an infected molar as well. Are you telling me that apparent gunshot wound is not from an infected molar?
That's what they're saying.
It's from the white strips.
Right. That's what
Not
they
the
said.
infected molar. Where did he put the white strips?
Right.
On his teeth?
Yes, on his teeth, but I guess it developed under his tongue, which you would think would be from
An infected
molar.
I don't know. I just wonder. I feel like the news.
But it was filled with hydrogen peroxide.
You're right. So is all the bleaching. Have you bleached your teeth, haven't you?
Honestly, I used Crest white strips one time in high school.
Yeah, well, that's the same thing.
I know, but if it was an
hydrogen
infected
peroxide.
molar, why would that make hydrogen peroxide under your...
No, it wouldn't. I mean, the hydrogen peroxide, if anything, would help the gum tissue around the infected molar. But when you have an infected molar, it can travel down the submandibular space, and that's what that looks like to me, not from the white strips. And so I just think that the facts of the story got confused.
Well, I didn't write the story. So.
I know, you didn't.
But yeah, and also what was so interesting to me about this was the fact that he admitted to using, he smokes, he said 10 cigarettes a day.
Right,
and
which means 20.
Right, which means a pack and a half. And then a cup of coffee, or 6 cups of coffee.
Right.
So it's like, your teeth whitening is totally negating.
Right.
Is negated by the fact of you're smoking and drinking coffee.
Right, yeah, he's a real health nut.
Right.
Pretty much.
So
I don't know. I'm surprised that Crest hasn't put out a statement yet going, are you nuts? He had an infected molar. But we'll see. Maybe it was from the white strips. And I might stand to be...
But my question is, why would this sac... if it was an infected molar, wouldn't this sac be filled with, like, pus and other sorts of...
Yes. Yeah. And I mean, there's a lot of things weird about this story that I can't explain to you.
Because they say it's just hydrogen peroxide.
Right.
Which...
That doesn't make a lot of sense.
It
That
doesn't
makes
make
about
any
as much sense as you putting a blindfold on me. 50 Shades of Meg. All right.
So
Anything
weird.
else?
Yes, thankfully. A South Dakota man is behind bars after he ran over his former dentist with his car and then threatened him with a hammer. But in a move usually reserved for the world's dumbest criminals, the suspect posted a video of the incident on his Facebook page before his arrest. The video shows footage from the dash of a vehicle slowly moving through a parking lot. The car accelerates towards the dentist, launching him onto the car. After the car stopped, the suspect goes out and threatens the dentist with a hammer. He was seen shortly after walking away with the potential weapon. Fortunately, the dentist did not have any serious injuries. The suspect is being charged with 2 counts of aggravated assault.
Wow. So this was something that was done specifically towards this dentist?
Yes. And the police say they don't know the motive, but obviously he was angry with the dentist, or he was just, absolutely out of his mind.
Is this not a hate crime? This can't be classified as a hate crime? Because it's against it's sort of against a minority group, right? Like dentists, we're kind of a small group. We're outnumbered.
Well, it's a hate crime in the fact that I think he hated the dentist.
Right.
And
that's
it was
what I mean.
crime.
Yeah, that's what I mean. But if you do it against a protected class of people, I think it technically becomes a hate crime. It carries like a bigger sentence. But well, here it is.
Here we go.
There's the dentist.
There
First
he
of
is.
all, dentist
Like,
cargo shorts never mix.
Look at him.
What's in? He's holding something in his hands. He's like, "What the hell?" And then that's not. How fast was he going there?
Couldn't have been more than 20.
Oh, I felt like it was slower than that even.
He's
like, here he's slowing down.
Right, and he's like, what are you doing?
Hey, what's up?
And he's
what's
like,
up? How's your molar? Ah! So was he okay, the dentist?
Yeah.
It looks like it.
They say that he sought medical attention on his own, so there was no ambulance or whatever. He's fine.
He should seek legal attention on his own. I mean, that's really
But who posted to their Facebook?
That's the part that's weird. That is way more better suited for Instagram. I think that's what you're saying. And you're tweet that stuff. Do not put it on Facebook.
That sounds like a Snapchat. Okay.
Exactly. There's no dentist on Snapchat. That's the one where it disappears, right? After 6 seconds. Got hit by him. Yeah, that's a perfect one to put on Snapchat or something else anonymous like that. But on Facebook, or put it on the dentist Facebook page if you're friends, perhaps, or in your Yelp review of his office.
But I mean, like, sure, he committed a crime, he went after the dentist, but to document it and then post it like you're proud of it, and it's just...
There was no backstory, like whether he had a painful cleaning or a bad root canal?
We don't know.
It's just open season on dentist people.
Apparently.
Well, thank you, Megan, and thanks to you, Josh, for holding down the fort while I was gone. That about wraps up this edition of Chairside Live. On behalf of myself, Megan, the whole CSL crew, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
Come back next time. You never know who'll be sitting here with me.
It's true. I'm Dr. Michael Latola.
I'm Megan Strong.
I'm Dr. Michael Latola.
And I'm Megan Strong.
And I'm back. See you later, Josh. The dentist without hair is back.
Back again.
That was really my introduction. I was expecting you to...
Oh, sorry.
Okay.
This week's viewer mail comes from a very special lady in Southern California, Megan Strong, and she writes, "Hello, Dr. Latola. I heard that you recently..." I was about to make a total joke. A 22... Blah, 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 blah. Okay.
No worries, mate.